Did you make a New Year's resolution? And if you did, how's it going so far? Studies say most of us, we drop out within the first week, but we have help for you today. This is Marianne Pritchett. She is the developer of Utah Health and Wellness Center. We also have nurse practitioner Mandy Johnson here and Dr. Brett Ludington. They're all going to get us back on track. How are you guys?
Great.
Good, how are you?
Thank you for being here. Marianne, let's start with you. What led you to open a wellness center and how do you help people there?
Okay, well, first of all, I'd like to say that you have a very healthy staff here. Everyone's beautiful and looks like you're right on your way with your New Year's resolutions.
We're trying.
70% drop out within the first week, so we will get into how we can help you with that. I've been in the medical field for 15 years and then was in the insurance world for 5 years and decided that there was something better out there, something more for people that could naturally work within their bodies so that we could live healthier. And with obesity becoming the #1 killer, I felt a real passion to try to research it, to try to see where I could make my medical niche and knowledge not only take care of a symptom, but cure what was causing the symptom.
Mandy, let's talk about some buzzwords in the health industry right now. Bioidenticals, something you know a lot about. What are those?
Bioidentical hormones are on the chemical level. It's the exact same thing your body makes naturally. So it's probably the best absorbed in your body. When we use bioidentical hormones, we also use a compounding pharmacy to put those medications together. So it's a more individualized approach to medication. At a compounding pharmacy, instead of giving you a pre-selected tablet that's 15 milligrams of something, I can say, I want this much of this ingredient, this much of this ingredient, and they'll put it together in a capsule for you. So it's a very much more individualized approach.
Right, you personalize it.
Exactly.
For the patient. Okay, low thyroid, also something you hear a lot right now. What are the symptoms of that? How do you know if you have that?
There's a lot of symptoms for low thyroid. Some of the most common ones are fatigue, difficulty losing weight, dry hair and nails, depression, weight gain. All of those things can be symptoms of low thyroid. And low thyroid's a huge thing. The American Thyroid Association found that about 20 million Americans have low thyroid, and about 60% of those don't even know they have something wrong. So that means for women, every 1 in 8 women will have a thyroid problem. So it's something that affects so many of us. Also with thyroid, the range of the most common test ordered by most practitioners is fairly wide, 0.45 to 4.5. So you can fall within normal range with your lab values, but still have symptoms of low thyroid. And it's at that point that you should have a full thyroid panel drawn to look and see if there's other abnormalities.
Well, and I love that you know those numbers because a lot of us are thinking, what? No, wait.
What does that mean?
What is that? And what does it mean? But I know so many people probably come in and they say you are normal and they're thinking, then what's wrong with me?
Exactly. You can go to your provider and they'll say, well, you're in the low to normal or the high to normal, but you're still having symptoms. And it's at that point that we need to look a little bit further and see if there's something else going on that we can hopefully fix the symptoms that you're having so you feel better.
All right, Dr. Ludington, another way probably or reason that people aren't doing their resolutions, pain.
Exactly. We start off with great ambitions. A week into it, we're hurting really bad. Maybe what was an ache has now turned into a pretty big ache, outright pain. We have some therapies at the office, including a class 4 laser therapy that can help reduce the inflammation in an area. If it's an injury, it can start to heal that faster, and more importantly, it'll get the pain down almost immediately. So we can kind of get an idea of what's going on and get it under control and get us back on track to following our New Year's resolutions.
Do you hear that a lot? Do you hear people say, is it chronic pain that you're hearing about, or is it's my knee, it's my shoulder, it's more localized?
I get a lot. Most of the people that I end up talking to in life have finally said, you know, I've had this ache for so long now, I just don't know what to do about it. It's just getting worse. What can I do?
And we put it off, don't we?
Exactly. Until then pain finally provides the motivation to talk about it.
Right.
When it gets high enough, you'll get motivated.
My husband needs to come see you. He has a shoulder that I've heard about now.
Exactly.
A shoulder that is not going well. Utah Health and Wellness is giving away free hormone exams and 2 body contouring treatments for all of you out there. So Good Things Utah viewers, if you're having a hard time staying on track, this is a great way to jumpstart that resolution. How do people do that, Marianne?
They can just contact us at the clinic. We can schedule their appointment. The body contouring is, you can do it on a lunch hour. It's in and out. People lose between 2 and 3 dress sizes in their first visit. And the exams are scheduled with Mandy, and she'll do 30-minute examination and see if we need to do blood testing or saliva testing to get anything more for the client.
This is a way to have a new you for a new year. Check it out. Go to our website and we'll link you, abc4.com, and then click on Good Things Utah. But that is their website right there, and it is utahhealthwellness.com. Thanks, you guys, for being here. Happy New Year.
Happy New Year.
Coming up next on the show, we are headed into the kitchen. How to spruce up your eggs when we come back.